What does it look like when you're going into the home to make sure that it's safe from a perspective? There's no tripping hazards. Like, do you do like an evaluation of the home?
What are some of the current frustrations that you have with some of our elder care?
We should be more accessible to more people. If you're not in the industry, almost nobody knows what's out there.
Welcome to the Empowered Elder Podcast. For many older adults, staying at home represents far more than comfort. It's independence, familiarity, dignity, and the ability to remain connected to the people and communities they love. But for families trying to navigate aging, caregiving, and long-term support, knowing where to start can feel overwhelming, especially when decisions are being made during a crisis.
According to AARP, nearly 75% of adults age 50 and older want to remain in their homes and communities as they age. Yet, many families don't begin exploring care options until after a hospitalization, fall, or medical emergency occurs.
And according to the CDC, falls remain one of the leading causes of injury and hospitalization among older adults, which is why proactive support, safer home environments, and early care planning can make such a significant difference in helping seniors remain independent longer.
Today's guest is Philip Sutton, or Phil, president of Assisting Hands Broomfield. After experiencing firsthand how difficult it can be to find compassionate, trustworthy support for aging loved ones, Phil and his wife Vanessa built their company around helping families navigate home care, aging in place, caregiver support, and the many resources that can help older adults safely remain at home with dignity.
And today we're talking about why proactive planning matters, the misconceptions families often have about home care and assisted living, and how the right support can dramatically improve quality of life for both seniors and caregivers.
We're your hosts, Tasha Beckman and Nicole Robilotto, and this is the Empowered Elder Podcast, where we talk about home, heart, and the next chapter of life.
Let's get started.
So let's start with the story of how you got involved in the senior space.
Sure. First real experience with senior care was with my dad, who died on hospice all the way back in '99.
Oh, I'm sorry to hear that.
Thank you. But it was quite an eye opener that this was something that people had thought about and cared enough to kind of make their career. A few years after that, my mom turned the house that we grew up in into a sort of assisted living group home. This was back in California, and my wife and I were over there quite a bit. She's a nurse practitioner, so she would do caregiver training, medication setup, and I would, cook lunch for the old ladies and play cards, and then her grandma started declining. We did what we thought was the responsible thing, and we found her the nicest assisted living group home she could afford, and we put her in it, and she hated it. She was absolutely miserable. Years later, when I, got hit up by a franchise broker and sort of started the actual path of joining the industry, Assisting Hands was one of the franchises that we looked at, and I almost got angry because I'm like, this would have been so much better for grandma. She would have been much happier with somebody coming in a few times a week. So kind of that background is what's made it my personal mission to go out and tell as many people as I can. There are so many resources out there for seniors. And so thank you guys for helping along.
Yeah, absolutely.
I'm kind of curious, when you said, I heard you say that your grandmother did not like assisted living. So what was it about that space in general that made you want to make thought that it would be a better environment for her to be at home? What was it specifically that was not?
So I don't want to knock assisted living.
No, not at all. Just kind of from a personal preference.
This was my wife's grandma. Change is hard. For some people, it's better to, stay in the home. For some, it's better to leave. In fact, her daughter, my mother-in-law, thrives now that she is in a senior community. So it really is based on personality.
Exactly. Okay.
And it's our mission at Assisting Hands to help our clients maintain as much independence as they can wherever they call home, whether it's, the house they've been in for 50 years or in a senior community somewhere.
So in essence, you're providing an option for those that might not find that the assisted living community is really for them.
Correct. And we also actually do a lot of work in assisted living communities where there is need for extra one-on-one. We, like I said, don't want to knock assisted living because sometimes
for sure
You're
not.
absolutely
For
right.
sure not.
we have to recommend that to our clients when they're no longer appropriate for home care. But it does give them an option, and it gives the communities an option as well to be able to provide kind of a higher level of care without breaking the bank of their residents.
So what's the dividing line between no longer appropriate and you can stay in your house?
It's a little squishy, varies by the person, but there are a few things that we cannot do that really push people over the line. Sometimes it's just a personality thing, but the things that we really recommend assisted living is when someone is no longer able to support any weight during a transfer. We can use some equipment, but usually the staff at an assisted living community is more familiar with that and better able to handle that than a home care caregiver would be. Another one is if they really need help sort of setting out their medications, we can remind them, but the law is pretty strict about us being a non-medical home care company, not getting involved with laying out medications or recommending, certainly. And sometimes it's finances, really. Home care is a great alternative to the community setting because it often can be cheaper. Doesn't always. There is a point at which the scales flip and it becomes more cost effective.
So when you're explaining what Assisting Hands does, what do you say is kind of like that summary descriptor of really who you are and what you provide?
Sure. So we always kind of keep that mission of independence, top of mind. I think that's really where we need to be at all times. But how do we do that? Kind of breaks down into 4 categories. The primary thing that we help out with, and the reason you would hire a home care company, is help with the personal care. So bathing, dressing, hair, teeth, nails, and those medication reminders. That's really where our primary value is. Although the next category is actually more popular. That's the housekeeping. So the 2 most popular services that we provide are laundry and meal prep.
Interesting.
That's really where what I've seen in the last kind of 4 or 5 years, that's where people first begin to struggle with maintaining themselves at home. So even just a little help with that, they don't want to stand in front of the stove for 3 hours,
Sure.
But they'd still like a home cooked meal. We're light housekeepers, we don't do deep cleaning, but we can really help keep a home clean and sanitary. The third category is transportation. Not all agencies do that. We do. Whether it's grocery shopping, pharmacy pickup, doctor's visits. I've got a couple of people who just want to go out for ice cream. Right? They don't get out of the house much.
That's fun.
I was going to ask you from a companionship.
That's number 4.
Okay.
Yeah. So companionship. Some folks like my mother-in-law are, social butterflies, and they're out in the community doing everything. My caregiver may be the only person they see all week. So it can be, and isolation is absolutely a killer. So the more you can flex those social muscles, I think the higher quality of life you can have.
And when you say the transportation, is it not only going to doctor's appointments, but taking an individual to those social activities or someplace where they can interact with other individuals? So it's not just to the doctor's office?
Absolutely.
Okay.
We generally don't take them to day programs because then there's they're paying us
Sure.
the day program.
Yeah.
Although I do have a veteran that we take to his Parkinson's class.
Okay.
And then after that, he and the caregiver sit down for lunch at the community center, and there's it's a good.
So your team member stays.
Right.
Got it.
Yeah. And that's where we can be often of real value too with the doctor's appointments, is that we can stay there. We can help communicate findings to the family rather than, just having somebody, Uber to the curb and having to get picked up later. So
I like that, having somebody so they're able to see what happens at the doctor's office, because the patient may not, or the individual may not remember everything.
right.
So then you're like,
I don't remember everything.
I was going to say, you're taking in so much information.
I don't know.
So-
They were talking about something. I don't know.
It's a little tricky because some families would prefer to be there
Sure.
instead. But if they can't
They
be,
can't.
we have a lot of clients where all of the family's out of state.
Mm-hmm.
So we're a great option for that as well.
Is there a minimum amount of time that a family
I was just going to ask that.
could work with you, or a maximum? I mean, both ways.
Sure.
That's a good question.
We don't have a weekly minimum. Every agency is different here.
Right.
There's a lot of great agencies out there that I respect and cross-refer to. So some have minimums, some don't. We're trying to help as many people as we can. We're still a fairly young agency, so we have not instituted a weekly minimum. We have had to institute a visit minimum just because my role as owner is to take good care of my employees. And if I can keep a good employee around, that's my priority, because then they're going to take good care of the clients.
Sure.
So all of our pricing and all of our policies are geared towards keeping good people around. So the 2-hour minimum that we have is just sort of based on that. It's not worth anyone's time to drive somewhere for sort of less than that.
2 hours is pretty reasonable, I would think, because there's not a whole lot you can get done in an hour.
Correct. And that's one of the other reason that we instituted the 2 hours, because even a shower with someone will often be a 2-hour process. Getting somebody into the right mindset for that, making sure it's done safely. You don't want to rush that. And for maximums, we do 24/7s. It's not frequent. They are very expensive. I won't lie.
Sure.
But some families really need that, especially towards end of life, where there's a real call for that kind of one-on-one supervision or just comfort. Yeah, we kind of run the gamut. People ask about 24/7s, and that's one of the times that we'll sometimes talk about assisted living instead, because they do have at least someone in the building 24/7, and they can usually do it for less expensive than we can.
There's a price differential.
Yeah, that makes sense. Where do you usually meet with the parents? Is it, or the patients? Is it usually when they're leaving the hospital, like if they've been in the hospital for care and now they're going home to a situation that they didn't need care before, but now they do? Is that typically where you're meeting your clients?
That's a big one for
Okay.
sure. We call that sort of the transitional care.
Okay.
The thing we worry about when someone's coming home from the hospital or from a rehab is rehospitalization. They're weaker than they were. They have a new situation. Maybe now they have a walker for the first time. They're probably on a bunch of different medications that they haven't been on before. So having some sort of home care in place to help support, whatever the discharge instructions are, can be really important and really beneficial to continuing the healing process from whatever has been done in the hospital or from the rehab. So we'll often do sort of a very intense, maybe an everyday or twice a day sometimes program for the first 3 to 7 days, and then taper that down as they gain strength, gain confidence in their sort of new situation. We see transitions as definitely a time when people first start to call us. We've partnered with a number of rehab hospitals and senior communities where they see that quite a bit, and we can be of assistance.
And then would you, when an individual is being released from rehab or the hospital, what does it look like when you're going into the home to make sure that it's safe from a perspective? There's no tripping hazards. Like, do you do like an evaluation of the home before the individual is released from rehab or the hospital, or is that up to the family or another?
No, we certainly do. Meeting the client in the hospital to do sort of the physical, assessment and conversation, and then a subsequent trip to the home just to make sure everything is safe. And the things you're talking about are definitely things we're looking for: trip hazards, fire hazards. Someone's got oxygen in the home. We have to be very careful about flame and space heaters and all sorts of things like that. We can make recommendations on things, and there's a lot of resources for that. I know some handymen who specialize in seniors. There are some programs through Medicaid and through long-term care insurance that actually can help pay for some of that home modifications. So there's a lot of things that we can consider and make suggestions about to make sure that when they get home, again, they don't trip and fall over.
So you said when you first learned about Assisting Hands as a franchise, you were frustrated that you didn't know about it way back, right? What are some of the current frustrations that you have with some of our elder care and maybe opportunities for improvement for our communities?
My biggest frustration really revolves around cost. We are not cheap. I won't lie. If you're paying privately, it's an expense, and most healthcare plans don't cover it. We try to provide as much help with people as we can. So we do work with a third-party biller that can help in some cases where that plan is there. Medicare doesn't cover what we do, except in one very specific case with the GUIDE program. There's a new program that just rolled out this year to help families with the relative with dementia. So that's one of the reasons we don't have the minimum. The weekly minimum is just, any help is better than none. Other issues that we have around finance are we work with the VA, we work with Medicaid, we work with long-term care insurance, and the billing on that gets frustrating. And just, we try to take as much of that off the families as we can, but that means that our life in the office gets a little more difficult. So cost is a big issue. We wish that more insurances would cover it. We wish it were more accessible to more people. If you're not in the industry, almost nobody knows what's out there, whether it's home care or placement or the different levels of assisted living and memory care. Most families are getting a crash course in this when they've got a loved one in the hospital. The more we can spread the word, not just in families in general, but also specifically to those, we actually call them crisis centers, that, hey, there's all these resources out there, please call me. And if I can't help you, I probably know someone who can. Or you guys would.
Yeah. It's all about the resources, right?
Absolutely.
Yeah. So we're building up our resources just like you do every day, right?
Absolutely.
Is there any way to start having those conversations a little earlier to kind of see what the options are, so you're not having the conversation when you're being released from rehab or you're being released from the hospital? So what would you say to families if you could give a message to them?
Absolutely start talking about it early. I part of my pitch whenever I'm out doing networking or whatever is, if you have a senior in your life, even if they're completely healthy, let's sit down and talk. Because knowing what the landscape looks like is so important, and it really helps ahead of a crisis to know that, hey, there's people out there who've got your back and can really help in a myriad of different ways that most people, like I said, just don't know that even exist.
Right. If you can talk about it early, you remove the emotional quadrant where you're trying to, shoot from the hip and we have to make the right decision, but we don't know if this is the right decision and all of that. And you're in a heightened awareness versus if you can talk about it early, you can have logic and, kind of a balancing act of what are your preferences?
Right.
Should this happen? We're not saying it's happening. It's not tomorrow, but should this happen, what would you want?
Absolutely.
Right?
And it's that's that same conversation that I encourage people to have about getting your paperwork in order, powers of attorney, living will or trust, funeral plans. Take that emotional thing off of your family. I know it's hard to have those conversations, finding an opening to start talking about it, because nobody wants to talk about dying.
And yet, here we are.
It's going to happen, right?
And really, honestly, talking about dying may be easier than talking about declining, because that's really scary as well.
I was just going to say, independence is a huge thing. People think, I've got this, I don't need any help. But I guess it's the way you talk to somebody about it and how you're going to enhance their life. You're not really taking away. So I'm sure you're having these conversations all the time.
Yeah, it's we meet a lot of folks who are stubborn, which is fine. I had a client who did move to an assisted living community, and when I visited him, I said, "How are you doing? How are you adjusting?" He said, "I hate it here. There's too many old people." He was 93 at the time.
Yeah, sure.
I love it.
But age is a number, right?
Correct. It's the mindset is
totally different. Yeah. So he didn't feel old.
No.
Yeah.
And 93 is pretty good.
Yeah. Yeah. Well, my mom was in the same kind of situation. She was in independent living, and she finally wanted to move back truly independent because all the people just felt like they were old around her. And age-wise wasn't the story, but it was the attitude and the approach to life. And, are you interested in other activities, and can we go do something? Right. So there's that balancing act too of what's the right solution of where you're going to be living if it's not in your current place.
Right. And this is where I really encourage people who are considering a community setting to talk to a placement agent to really find out what the pulse is of these different communities that you're thinking of. And sometimes none of them are appropriate and it's time to move back home. But often there, I visit a lot of the communities, at least in my area, and they all have a certain social fabric, and it's different for each one. And what's right for you may not be right for you. My mother-in-law's been in 3 or 4 until she really found one that she absolutely adores, and she's living her best life now.
But it's the same as when we decide to move homes when we're younger, right? You're moving for something different, something better, something is not working where you currently are, right?
Absolutely.
So it's the same thing. Just because you make a decision that you want to live somewhere doesn't mean that it has to be a permanent decision.
Right. And when we do move homes, we're usually using a real estate agent,
right?
Who can help guide you.
Yeah. Hence
Same
the
thing.
placement agent.
Same thing.
That's right.
Yep. It's always good to have that professional assistance, I feel. Sometimes people will, live close to a community and that's, the geographic location is more important to them, which is great. But in cases where you're open to a wider geography, then that's when placement really comes in, I think.
Or if you have a friend, maybe there was a neighbor or a friend that's there that might make more sense. I'm like, what, that's where I want to go. Want to be, friends or just stay together. So that could be an occasion.
You play mahjong or cards
that's
all
right.
the time.
Absolutely. So, why not continue it?
Exactly. So for someone who's listening that they're thinking in their head, okay, we're not quite there yet with mom, dad, friend, whatever. What are some of the typical signs? I know that everything is unique and there's not a cookie cutter, but what are some of the typical signs that it might be time to explore what those options look like?
That's a great question because it is so very. So I'll just kind of give you some of the things that we've seen. Weight loss, loss of energy, often not feeling like wanting to cook. And so we're going to just kind of snack all day. Not getting enough hydration affects so much energy. I'm a big fan of hydration.
Yeah, exactly.
Changes in mood can be really big because they can so often be traced to some lack or some struggle that someone's having. So I would say really if you're feeling that a loved one is changing mood wise, it's time to start digging and asking some questions and hopefully visiting and taking a look. I've got clients who, their families tell me, she was a meticulous housekeeper for decades. And now you walk in and, dirty dishes in the sink and, the floors are a mess and she may just not have the energy to do it. Like I mentioned that, it's kind of more popular services that we do is the housekeeping. That is honestly one of the first warning signs that someone might be needing some help in the near future because the energy isn't there.
And do you see often, even when there is a spouse or a loved one that's living in the home, that still home care is an important part? And what does that look like when there's a significant other, someone else in the home?
So it's a very frequent situation we have where there's a family caregiver of some sort, whether it's a spouse or a child or sometimes grandchildren. And one of the big things that we warn about is caregiver burnout. My
that
mom,
is a real thing.
Absolutely. My mom, who ran the group home, absolutely wrecked her health caring for these 6 ladies. Was the first resident was my grandma. It's hard. We don't like to talk about very often, but in the case of a spouse, the majority of the time, the caregiving spouse is the one who predeceases the spouse who needs the help. So getting home care in there or getting into a community setting is vital for both partners there, just to take some load off. I'm really excited about the government has finally figured this out with the GUIDE program. So the Medicare GUIDE program is for if someone has a dementia diagnosis, it's respite care for the spouse that is providing or the family member. 72 hours a year, which is not a ton, but it's enough to get them out of the house and go take care of themselves for 4 to 5 hours, whatever it is.
Right. Go get a breather, go get a massage, get a pedicure, go for a walk.
I've had people who just drive around. So we're getting there, I think, with some of the government programs, and hopefully the insurers will follow suit, coming back to our earlier discussion about frustrations, to really make this accessible to more people, because it's such a vital part of our lives. Those are supposed to be our golden years, right? Let's take good care of ourselves and our loved ones in those years, and not have to worry so much about, what's the next step going to be.
Today's conversation reminds us that aging in place is about far more than simply staying at home. It's about preserving independence, dignity, connection, and quality of life as people grow older.
What Phil Sutton shared so clearly is that many families don't realize how many care options and support resources are available until they're already facing a crisis. And by then, the choices can feel much more overwhelming and limited.
In the next part of our conversation, we'll dive deeper into hospital to home transitions, the realities families face after a health emergency, and how proactive home care can help older adults avoid unnecessary hospitalizations while reducing the stress for families.
We'll also explore the financial side of care planning, including VA benefits, long-term care insurance, Medicaid resources, and why so many families miss opportunities simply because they don't know where to start.
So be sure to join us for our part 2 of our conversation with Phil Sutton.
We're your hosts, Tasha Beckman and Nicole Robilotto, and this is the Empowered Elder Podcast, where we talk about home, heart, and the next chapter of life.